Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Loneliness and social isolation can impact health and well-being so much so that the Surgeon General issued an advisory about the loneliness epidemic. To help combat loneliness among his patients, Dr. Maulik Joshi, president and CEO of Meritus Health, created the Care Callers program, where volunteers call patients just to check in. Today, we're talking about how the program has succeeded beyond all expectations and how little actions can make a big difference when it comes to loneliness. Let's listen. Dr. Maulik Joshi, thank you so much for being on Public Health on Call. Today, we are going to talk about loneliness. So tell us a little bit about the epidemic of loneliness that's happening.
Lindsay, thank you so much for the opportunity. Really appreciate what you're doing. So unfortunately, as you know, loneliness is a significant impact, not just on your mental health, but your physical health. The research says that being lonely or socially isolated has the same effect on your health like smoking 15 cigarettes a day. And it's true, I would say. And, unfortunately, COVID also had a bigger spotlight on this. People were more isolated. And so we're seeing bigger and bigger impacts on health as a result of this. And, the thing that we've tried to understand is little things can go a long way with loneliness. And so that's what we're going to talk about, I know, with our Care Caller program. But I guess the one thing I would say is most importantly is being isolated, being lonely is a huge social problem in our country and has a huge impact on your health.
So first, let's talk a little bit about who is this impacting the most?
Yeah. So, when we look at who says they're lonely, because we ask people before they come to their doctor's office a few questions. We ask them, do you worry about putting food on the table? Do you worry about paying your utility bills? Are you lonely? So we ask what we call our social determinants of health. And what we see is almost 10% of the patients say they're lonely. So that's 1 out of 10, which is amazing. And then when you look at who that is, 30% are married, 30% are under 60 years of age. So we look at all the stats. I think generally people think, well, it's those older Americans living by themselves, maybe without much support. It's not. It's all of us. You can be with someone and be lonely. And so again, it's everybody is essentially the message.
So no one is immune.
No one is immune. And, again, that's part of the mental health stigma, I think, also is it's okay to say that you're lonely and you need connection. And we should figure out ways to make that happen.
So of the people that are experiencing loneliness, can you tell us a little bit about the health impacts that you're seeing?
Absolutely. So of those who are lonely, what you see is, unfortunately, increased mental health challenges. So they're more depressed. Again, you're seeing chronic conditions worsen because you're lonely. You're not keeping up with your health, your diet, your activity, your diabetes may not be in check. So things that you think like, oh, on their own, there are significant medical issues, but loneliness only exacerbates it, unfortunately.
Now let's talk about what you're doing to help combat loneliness. So tell us a little bit about Care Callers.
We started this about 1.5 years ago. We said, okay, we know loneliness is a problem, and we set a bold goal. We said, let's try to eliminate the loneliness epidemic. What can we do to do that? So we started with a simple thing we called Care Callers, which is, why don't we call people? Why don't we find out if you're lonely and if you're willing to have someone call you? And let's have volunteers call individuals once a week, maybe once every 2 weeks, 15, 20, 30 minutes, just to say hello, just to start building a connection and a relationship with people. So we started as a pilot, as you can guess. We had a couple of volunteers back in, again, 1.5 years ago. And we just had a couple of people that said they were lonely and said they were willing to have someone call them, a care caller. And we started, and we went about a month and no one got hurt. And it seemed to, people enjoyed it. So then we expanded it to a few more volunteers, and we kept expanding and we kept asking. And we're now up to over 250 people are being called either once a week, once every 2 weeks, from 40 volunteers. And we've since hired 2 care callers. So again, very low cost. And throughout the whole time, over 500 people have been called. So I can get into much more, but it's a simple way. It's just picking up the phone and talking to people.
And you yourself pick up the phone and talk to people. So tell us about how some of those interactions have gone for you.
I am privileged to be able to do this. So as we say, you always have to get close, right? You have to get close to the patient, to the community, to know what's important to them and what we can do to make a difference in their lives, because that's what it's all about, right? Our mission is to improve the health of our communities. It's how do we impact their lives? That's our social obligation. So we started calling, and I'm not a social worker. So, and my wife might even say I'm not great with people, but let's say, I'm okay with that. Here's what we found. I have a privilege of calling 2 people. One person, she lives by herself here in our town. She's 97 now. And we talk about what does she watch on TV? We talk about she got a new roof last summer. Really just chat for 20 minutes. And every week, the story I tell is we did this for about 4 months. And I missed a week calling her, and she called me. And she checked in on me and even remembered that I had allergies during the seasonal time and asked me how my allergies were. You form a little bit of a bond or a relationship. One time she also had trouble getting certain TV channels on her TV. And I offered to go by her house and try it out. And now I'm not a member of the Geek Squad, and I did not do well on that, but we've, again, started to connect. And so we stay in touch. And every week, 2 weeks, I talk to her. The second individuals I get a chance to have a relationship with, she also lives by herself. She goes to Meritus Health for a lot of her care. And I've been fortunate to help her with transportation needs. I call our care management when she needs that. When she needs certain doctors or specialists, I help her to connect with them. All the little stuff that we would say like, that takes up their day, and they have to worry about like, how am I going to get to my doctor's appointment? And if they prescribe something for me, how am I going to get there? I don't do it myself, but we have people who live to do this all the time for people. And so we do that. So it's anywhere from the medical things to really more importantly, the social things, the things that connect individuals and the things about their lives and what's important to them. And we chat. And again, so I get as much out of it as they do. My recent individual I spoke to, she asked me how my back was because about a couple of weeks ago I had back problems. So again, we're just trying to, as I say, be good human beings and talking to people.
And what kind of feedback have you gotten about the program?
So we ask everybody who's been in after 4 months, are they less lonely? We ask a simple question, then we ask a second question of what do they need more of? 96% of the people say they're less lonely after 4 months. Now, I don't have hard data that says they're coming to the emergency room less or other things, but this is all good. We're trying to make an impact on someone's life. If someone feels less lonely, that's a positive, especially through volunteers and people, working. I would tell you, my entire leadership team are care callers. That's the expectation. If, we round on patients in the hospital as a chance just to say hello, how things are going, then we should round on residents in our community, right? That's, again, we're more than a hospital. We're here to take care of health. So those are the little things I think that go a long way. The other thing I'll tell you is a few months ago, we said, hey, how about we bring people together? So we actually had a lunch get together. We invited a bunch of people, and about 30 of our individuals in the care caller came along with the care callers, just in a conference room, and just as a chance to get to go. And people say, hey, this is nice. We're planning to do that again this fall. So I think it's all the little things you can do to make a connection. And I would say one thing, people worry is like, well, I don't know how to do this. I'm not professionally trained. And we always say if it gets beyond your skills or abilities, we can hand off to a mental health professional or someone else. But it doesn't take much to be a good human being. It doesn't take much just to say hello and how are you doing and tell me about this. And the next week you remember and you keep going.
Well, this sounds like it's had significant impact in your corner of the world there, but you said you want to take on the whole loneliness epidemic. So who else can get involved in this?
Yeah, thanks so much for that question. I would say, first of all, if you're interested, you're always welcome to do it with us. You could go right to our website, meritushealth.com, and type in care caller, and we've got the form for you to sign up. And we have individuals who don't live in our community that do have lonely residents in our community. They just want to do it, which is great. So I would encourage it. But I would also say in your own community, you could do this. I have friends who said, look, during the pandemic, I just called different people every week who I thought maybe they weren't just as connected, just to check in on them. You could do that now. You could work with your health system, your nonprofit organization, and create abilities and networks to just call people. I think people are willing to raise their hand to say, hey, I'd like someone to call me. And there are people who are willing to do that as well. There's a great spirit of volunteerism. And this is a nice kind of volunteerism. You don't have to show up somewhere at a certain time or so. You create that cadence. I actually talk to my individuals a lot during the weekends because that's when I generally might have more free time. So it could be on a Sunday night or Saturday afternoon. So it's nice to be able to do that. And again, we're building a relationship, which is important.
Well, I'm sure it means a lot to people to get a call from the president and CEO himself. But thank you so much, Dr. Joshi, for everything that you've done and for taking the time today on Public Health on Call.
Lindsay, thank you so much for the opportunity.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.